Hello everybody, this is Stephanie Rose 88. I want to make a video today about Suboxone, in particular Suboxone and pregnancy, and Suboxone and breastfeeding. It may be more than one video, I'm not sure just yet. Yeah, I have 4 years clean this month, so I'm really excited about that. And I've gotten a lot of comments on my Suboxone videos. Some people say some negative stuff. I usually just totally ignore them. But other people have had some legitimate questions, and I wanted to try and share my story so that maybe you can have more confidence yourself. I had 2 babies while taking buprenorphine, Subutex. Okay, that's pretty standard that when you're taking Suboxone, they'll switch you to Subutex because Suboxone has buprenorphine and naloxone, and Subutex only has buprenorphine. So it's just better to expose your unborn babies to one medication instead of 2. So a lot of doctors will try and scare you into taking methadone instead because methadone has been around. Methadone has been used in pregnant women for a lot longer. So some doctors, in order to try and cover their butt, hold on one moment, please. Some doctors will try and convince you to take methadone when you tell them that you're pregnant. And they do this because they are clearly uninformed. First of all, you should never switch. If you get pregnant while you're taking Suboxone, okay, you should not switch to methadone. It's a different medication, and it doesn't make any sense to do that at all. And it's actually dangerous for your unborn baby to you want to keep things static, okay? When you're pregnant, you want your unborn baby to have a stable environment in utero, so you don't want to be switching your medications around. So the best thing to do is to just switch to Subutex, which is Suboxone, except it doesn't have the opiate blocker in it. It just has the buprenorphine. Now, some doctors will try and tell you that you need to get off completely, that they don't want you on anything. And once again, they are not informed. There's a lot of risk involved with getting off of Subutex when you're pregnant. I mean, some people still decide that they want to do that, and I'm not saying that you can't if you've done all your research and you still want to do it. But really, it is not recommended to do that. I think a lot of pregnant women feel like, oh my gosh, I'm pregnant, I have to get off, I don't want my baby to go through withdrawal, and they're really nervous, and they're really afraid for their unborn baby. They don't want anything to happen, and of course, I'm a mom, I understand, the best case scenario is to be on nothing. But the fact is, if you get pregnant and you are already on Suboxone, it isn't safe. It's really not safe to withdraw. It is not recommended to do that, okay? It can put your baby in distress, and it could even cause miscarriage. So you don't want to do that. It's better to be born on Subutex than to not be born at all, right? So it's actually a greater risk to your baby. Now, you might get a lot of ignorant comments from people. I've heard them myself, where people will be like, oh, how could you bring a child into the world while you're on this medication, and then go on and on and on. And, my suggestion is to do your best to ignore those ignorant comments, ignore people who are putting you down. They really don't understand what it's like to be addicted, and they really don't understand much about Subutex at all. So, so really the best thing for you to do is to stay on the Subutex. Now, there has been a lot of research comparing the outcome of neonatal withdrawal with Subutex and with methadone. Now, I'm not trying in any way to put women who have taken methadone while they're pregnant down. Please don't take that and like I'm trying to put you down at all. But it is just established fact that babies fare a lot better as far as withdrawal overall when they're taking Subutex. Alright, you want links on the bottom of the video so that you can check things out for yourself. Babies do better on Subutex when they're born overall. than babies who are born on methadone. So actually, when I was pregnant with my second daughter, my doctor kept trying to get me to go on methadone, which, like I said, you're not supposed to switch medications, and methadone is worse for your baby. So I don't know why he was trying to do that, but really it's because, like I said, methadone has been used in pregnant women for a longer period of time, and some doctors feel like, well, we know exactly what happens, and so they just feel like it's safer, but it isn't. So anyway, also when your baby is born, wait, let me get to that later. During your pregnancy, you're probably going to need your dose to be increased. That's because when you're pregnant, your blood volume increases. So you may begin to start feeling sick, and you may be like, oh, what's going on? Why am I feeling sick? And it's because your body has a lot more blood, up to like 50% more blood when you're pregnant. So you're gonna need a higher dose. For me, that meant that I went actually up to 24 milligrams with both of my daughters, and I have chronic back pain, so that was part of it too. My back was just hurting me excessively. But after I had my babies, both times I went down 8 milligrams right away after I had them, and I didn't even feel it. And that's because I wasn't pregnant anymore, so I didn't need such a high dose. Currently, my second daughter is 8 months old, and I was on 24 milligrams at the end of my pregnancy, and I'm now down to 6 milligrams. So, it's a big difference. But when I was pregnant, I needed that high of a dose. And when your baby is born, you're probably gonna, if you're giving birth in a hospital, which probably most of you are, I know that I couldn't find any healthcare provider, any midwife who was willing to see me at home, because technically, if you're taking Subutex while you're pregnant, your pregnancy is considered high risk. To me, it didn't make any sense, because I'm like, well, my medication isn't going to affect anything when I'm giving birth. Like, there's no difference. But after the baby's born, within 12 to 24 hours, they might have some withdrawal. So to me, it doesn't make any sense, where you give birth. But anyway, they probably won't let you give birth at home. So you'd either have to have an unassisted birth at home or be in a hospital. So I'm assuming most of you will be in a hospital. I really, really hope that you will be treated with respect, and that your rights will be acknowledged and respected. But as we know, far too often we get judged, right? They see you come in and they're like, oh, you're on Suboxone, huh? And they treat you like, you just must be the scum of the earth. You're gonna be a horrible mother, and you don't even deserve to be having this baby. And your baby, a lot of times they'll treat your baby like they're sick when they're really not doing anything. So you have to be careful, because there's been studies that have shown that when the doctors or the nurses don't know that the mother has taken Suboxone, only 20% have withdrawal symptoms. So that's a pretty small amount compared to, I think it's 50% that has been found to have withdrawal symptoms when they know about it. But also, some of those patients were taking other drugs other than Subutex. Really, I would recommend, a lot of times, okay, especially if you get pregnant, say you were on heroin or Oxycontin or anything, and you get pregnant, okay, and you want to keep the baby, and you are doing everything that you can for your health and your baby, and you get on Suboxone, Subutex during your pregnancy. A lot of us are not in the best of health, right? I don't know of any drug addicts who are really, oh, I gotta eat fresh vegetables every day, and I gotta see the dentist, and I gotta, take care of myself. No, when you're in the middle of an addiction, you're not taking good care of your health. So a lot of women who are newly pregnant and newly in recovery are not very healthy. So really, you should do your best to quit smoking if you're smoking. There are risks associated, of course, with smoking cigarettes while you're pregnant. I know it's really hard, if you just quit heroin or whatever you were addicted to, and now it's like, oh no, I gotta quit smoking cigarettes too, and change all these things, and it can be really stressful. But do your best. please just do your best, because the chances of your baby being healthy when they're born are so much greater if you're not smoking cigarettes. And also, if you're eating healthy, do your best to eat lots of fresh vegetables, lots of fruit, lots of good healthy foods. Try and take some multivitamins, prenatal vitamins. I took something called Floridix, iron and herb. It's a liquid, and it really helped my anemia. I was anemic, and it's a natural iron supplement. A lot of women really don't want to take the iron supplements when they're pregnant. They make you constipated. They're huge pills. And your body really doesn't absorb much of that iron because it's not really absorbable for your body. So Floridix iron and herb is something I would recommend. It's very good for your iron, and you should take vitamin C. Vitamin C helps you absorb iron. So pay close attention to your diet. Quit smoking if you can quit smoking. If you can't totally quit smoking, smoke the least amount possible, and make sure that your doctor is not letting you get sick. If you need an increase in your dose, I know you can feel like, I don't want to increase my dose because I'm pregnant, but it's not good for you to be sick. If you feel sick, your baby's going to feel that, okay? And you don't want your baby to feel that. So, you want your baby to have, like I said, a stable intrauterine environment. So, anyway, I had both of my girls in the hospital. One with an OBGYN, didn't have a very good experience with that. The second time with midwife, and overall that was a good experience. Both times I was sent home within a normal amount of time. My babies were not in the NICU. The second time, I'm in New Jersey. I gave birth in Morristown Hospital, and the doctor, the pediatrician, said that it's standard practice there that they keep the baby for a week if you're on Subutex, and they watch them. But thankfully, she was willing to not enforce that rule. I think because she could tell that I was an experienced mom, that I was a caring mom, that I was educated in my health, my baby's health, my medications. Obviously, my drug screens were clean. They had been clean my whole pregnancy. Which is another thing I would suggest if you are, even if your doctor isn't insisting on monthly drug screens, I would do it anyway, because it's really a helpful thing for you to be able to say, well, look, I have 9 months of monthly drug screens, and all of them were good, so, and please, if you're struggling, if you feel like you want to get high, talk to somebody, see a therapist, maybe increase your dose. I have found Subutex to be pretty phenomenal drug. I mean, it took away my physical cravings entirely. It's not going to do anything for psychosocial cravings, if you're like, I'm depressed and I want to get high, well, then it's not going to help you. But it takes your opiate receptors in your brain are filled, so they're not going to be screaming at you, give me opiates, give me opiates. So you don't have to deal with that. You can just focus on getting better. You can focus on being stable. You don't have to be fighting cravings 24/7. And for me, that was just, an incredible relief. And I have not gotten high for 4 years, like I said. Now, when your baby's born, a lot of women are told that they shouldn't breastfeed because they were taking Suboxone. And that's just absurd for a lot of reasons. And it really upsets me that women and babies have been deprived of their rightful breastfeeding experience because of ignorant physicians. There is absolutely no reason why you should not breastfeed your baby while taking buprenorphine. Okay, I'm just going to say that right now. And again, I will put information on the bottom of the video for you to look into that yourself. Also, if you get, Dr. Thomas Hale has a book called Mother's Milk and Medications, or Medications in Mother's Milk. I have the book, but I wasn't able to find it today. I wanted to read something out of there for you guys, but I can't find it. Anyway, there are really very few reasons to ever not breastfeed. Too often, women are told that they should stop breastfeeding or wean temporarily when there is no reason to do that. Breastfeeding is the normal way for your baby to eat. And a lot of times things are presented as like, well, there is a possible small risk with breastfeeding and buprenorphine, so just use formula. But that's working under the assumption that there's no risk with formula, and that is simply not the case. There are a lot of risks with formula feeding. I really wanted to breastfeed my oldest daughter, and I didn't do it for very long for a lot of reasons. Mostly, I had a lot of just had some issues breastfeeding, and I wasn't as educated as I was the second time around. So I did end up giving her formula after she was 2 months old. But my 8-month-old is still nursing, and I breastfed her exclusively for the first 6 months, and now she is eating solid food, but her main source of nutrition is still breastfeeding, and she is the happiest, healthiest, fattest, funniest little baby you would ever meet. You know, only about 2% of your medication will go through your breast milk. I was surprised that even one of the midwives in the practice, was not very supportive of me breastfeeding. I really felt like she just didn't think that it was a good thing for me to do. She didn't think it was going to work. She thought my baby was going to be affected. I mean, I really didn't get a feeling like she was supportive of that for me. And that made me sad. And there was another woman in the practice who was also on Subutex, and there just wasn't a lot of support for her to breastfeed, and I really didn't understand that. There are a lot of risks with formula, and I'm going to put a link down here from the United States government, the National Institute of Health, that goes over all those risks. So when you choose not to breastfeed and go on formula, it's not like you're choosing an option that has no risk. Okay, so there are incredible benefits to breastfeed for your baby and for you. And if you want to nurse your baby, there is no reason why you cannot nurse your baby while on Subutex. Now, some of your doctors might kind of harass you about that. Maybe they will feel like it's not a good thing for you to do. I suggest that you get all the information that you can, print it out, bring it to your doctor. Let them know while you're pregnant that you are intending to breastfeed, that you will breastfeed your baby, that SAMHSA recommends that you breastfeed, and bring, maybe you can go to the library if you can't afford to buy the book that I spoke about, and, copy the page about buprenorphine and breastfeeding, and show your doctor that it is safe to breastfeed on buprenorphine. Another issue is maybe your doctor will not want you to remain on Subutex. As we know, a lot of doctors don't want to give out Subutex because they feel that that there's a greater chance of you abusing Subutex than Suboxone. Thankfully, the doctor I have now is he knows me pretty well now. He knows I'm not going to get high, and he has been respectful of my decision to breastfeed and to stay on buprenorphine. It's better to take Subutex while breastfeeding than Suboxone because of the same reason when you're pregnant. It's better to use just one medication rather than two. You can breastfeed if you're on Suboxone, but if you can, I would really stress with your doctor that breastfeeding is very important to you. It's the best thing for your baby, and that you would rather take buprenorphine while you're breastfeeding. Hopefully they will respect that. If they don't, then you can breastfeed on Suboxone, or you can try and find a new physician. I know that's easier said than done a lot of the times, unfortunately. But I've had a very good breastfeeding relationship with my second daughter, and I am still on Subutex. A lot of women are just really nervous about the outcome while they're on the medication and they're pregnant. The truth is, the majority of the time, the vast majority of the time, everything is totally going to be fine. Okay, I'm going to put another link in the video that explains why it does not make sense. If you give birth to your baby and the doctors are saying that your baby has withdrawal and they want to keep the baby in the NICU, your baby should not be put on methadone. Okay, there's no reason to take a baby who was born on buprenorphine and put them on methadone. And I'm going to put a link about an article that explains that too. Okay, you might have to fight against some prejudice. I hope that you don't. maybe you'll have a good experience, maybe you'll have good nurses and a good doctor. Thankfully, the pediatricians that I had both times were really, really good, and they treated me well, and they treated my babies well, but that's not always the case. And sometimes we have to advocate for ourselves and for our babies. So you need to arm yourself with as much medication, as much education as you can. Print stuff out. Have several copies of information with you. Bring it with you. Hand it to someone who is trying to tell you otherwise. And if they are still ignoring your request to breastfeed, or if they're treating you badly and you know they're discriminating against you, speak to a patient advocate. Go up the chain of command in the hospital. Insist that that your rights are respected and that your baby is respected. Do so respectfully. Don't start freaking out and yelling, because you know that they will jump on that opportunity to say that you're nuts and you're a crazy drug addict and you can't take your baby home. So you want to be always calm, always respectful. If someone's really upsetting you, just stop talking to them and insist that you talk to the person above them. If you don't get a good answer from their manager, go up the chain of command and just keep doing that. I try to enjoy your pregnancy. I know, especially if you're recently in recovery, it's probably very stressful. We come from all walks of life. We're in all kinds of situations. Some people don't have a lot of support systems in place. Please try to have the best support you can. Find the best supportive physician that you can, or midwife if you can get a midwife, and know that you are this baby's mom, and you are making the best decisions that you can for your baby, and hold on to that. I have gotten negative comments even on YouTube. Like, why would you bring a child into the world on the medication and yada yada. I have two really healthy, really happy, really full of life little girls, and who are very happy to be alive. and I'm a damn good mom, if I do say so. So I try not to let that get to me. It can be hard sometimes. It feels bad, but you can have a good pregnancy, and your baby can be totally healthy. And I wish you all the best of luck. Bye.